Understanding the distinctive differences between ADHD and cognitive impairment due to depression and sleep deprivation. Attention deficit hyperactivity disorder, ADHD, and cognitive impairment resulting from depression and sleep deprivation are often conflated, but it's crucial to recognize their distinct differences to ensure proper diagnosis and treatment. While both conditions can lead to challenges in concentration, memory, and daily functioning, the root causes and manifestations of these issues are notably different. ADHD, a neurodevelopmental disorder. ADHD is a neurodevelopmental disorder that typically begins in childhood and often persists into adulthood. It is characterized by persistent patterns of inattention, hyperactivity, and impulsivity that are inconsistent with developmental norms. Individuals with ADHD struggle with executive functions, such as organizing tasks, managing time, and maintaining focus on tasks that require sustained mental effort. These symptoms are present across various settings, e.g., home, school, work, and are not solely the result of environmental stresses. The cognitive difficulties in ADHD are primarily due to differences in brain structure and function, particularly in areas like the prefrontal cortex, which is responsible for attention, impulse control, and working memory. These challenges are intrinsic to the individual's neurological makeup, often requiring a combination of behavioral interventions and medication to manage effectively. Cognitive impairment. Due to depression and sleep deprivation, a consequence of external factors. In contrast, cognitive impairment resulting from depression and sleep deprivation is typically secondary to these conditions. Depression can lead to what is often termed brain fog, where individuals experience slowed thinking, difficulty concentrating, and memory issues. However, these symptoms are usually accompanied by other hallmarks of depression, such as persistent sadness, lack of interest in activities, and changes in appetite or sleep patterns. The cognitive decline in depression is largely driven by the emotional and psychological toll the disorder takes on an individual. Similarly, sleep deprivation can severely impair cognitive function, leading to problems with attention, memory, and decision-making. Lack of sleep disrupts the brain's ability to consolidate memories and process information, resulting in a temporary state of cognitive decline. However, unlike ADHD, these impairments are typically reversible with adequate rest and treatment of the underlying sleep disorder. Key differences and implications for treatment. Understanding these distinctions is vital for treatment. ADHD requires a targeted approach that may include stimulant medications, behavioral therapy, and accommodations to support executive functioning. In contrast, cognitive impairments due to depression and sleep deprivation are best addressed by treating the underlying causes, whether that means antidepressants, psychotherapy, or improving sleep hygiene. Misdiagnosing ADH when cognitive issues are actually a symptom of depression or sleep deprivation can lead to ineffective treatment and worsening of the individual's condition. Conversely, overlooking ADHD in someone who struggles with focus and attributing it solely to sleep or mood issues can deny them the specific interventions they need to thrive. Conclusion. While ADHD and cognitive impairment from depression and sleep deprivation share some superficial similarities, they are fundamentally different in their origins and manifestations. Recognizing these differences is essential for accurate diagnosis and effective treatment, ensuring that individuals receive the appropriate care and support tailored to their unique needs.